Midwives have staged an angry protest outside State Parliament. They've accused the government of breaking a promise to restore maternity services at Mona Vale Hospital on Sydney's northern beaches. Asbestos concerns closed the unit last year, but it was meant to reopen in June. The government has since scaled back services, and health workers are demanding answers.
After more than 40 years working as a midwife, Jan Heeks wasn't ready to retire.
They always said at Mona Vale that I would probably die on the workplace.
But the sudden closure of the hospital's maternity ward changed that.
That was a big shock. 6 weeks' notice to say that we had to pack up and get out.
The ward closed in July last year so asbestos could be removed from the building. The state government promised it would reopen in June this year, but it missed the deadline.
The government has consistently said that Mona Vale will be sustained and upgraded as necessary, and that has not happened.
Before the ward closed, the opposition demanded assurances from the government, asking, are there any plans to downsize maternity operations at Mona Vale Hospital following the completion of the asbestos removal process? The then Health Minister, John Della Bosca, replied no. But in July, a backflip, with the government announcing the hospital would have a midwife-only service. Some of those midwives gathered outside Parliament today to vent their anger.
Where do we want it?
It was the intention for maternity services to be reopened and provided from Mona Vale.
But the Health Minister says after consultation, it was decided the midwife-only service was the best use of resources. These protesters say Mona Vale Hospital's maternity ward simply can't operate without the help of obstetricians. They say in the event of an emergency, patients will have to be transported elsewhere, putting their health at risk. Jan Heeks says if she was an expectant mum, she wouldn't take the chance. David Lewis, ABC News, Sydney.